So our example here for sub, referring to under or less than, is subdural. So let's break down the term subdural. Sub meaning under or below. Dural, as we mentioned previously, referring to the dura mater. So the dura is one of those protective layers of the brain and spinal cord. And we'll talk about this in the context of a subdural hematoma. So again, the brain is protected by 3 thin layers of tissue called the meninges. The outermost and toughest layer is called the dura mater. Now, these meninges extend all around the brain, and as we saw previously, protect the spinal cord as well within the vertebral column. So the dura mater is a strong protective covering around the brain and spinal cord. Therefore, a subdural bleed means bleeding under the dura mater. So a subdural bleed will occur when blood collects between the dura mater and the surface of the brain. This usually happens when veins are torn. This could happen due to a fall, so a head injury, and blood will slowly accumulate in that space. The skull is a very hard and enclosed space, and there's not very much extra space within. Therefore, when blood builds up, this will increase what's called intracranial pressure, so the pressure within the cranium or the skull. And that pressure ends up pushing on the brain, and we can see here how the dura and the meninges are kind of moving inward and putting pressure onto the brain. This, of course, can cause serious symptoms, extreme headaches, can cause some cognitive symptoms such as confusion, drowsiness. If pressure becomes very severe, of course, this pressure may need to be released. So sub, under, or less than, subdural. This is referring, again, location speaking, beneath or under. Supra, the opposite being above. Now our final prefix for location is trans. So the prefix trans refers to across or through. Our example here, and often in medical terms, it's used to indicate sometimes a procedure or effect that kind of passes through a structure, especially when we talked about the body planes. We talked about the various planes in which we can kind of view cross sections of the body. So trans was relevant there when we were talking about for the horizontal planes. Now, for these examples, we have transurethral resection of the prostate. So trans meaning through, urethral relating to the urethra. And the meaning of this term or this procedure is a surgical procedure where the prostate tissue is actually removed through the urethra. So in this instance here, this is often used to treat urinary obstruction caused by an enlarged prostate. This can be associated with benign prostatic hyperplasia. We know from our cancer unit, hyperplasia refers to an increase in the number of cells in a tissue or organ. So an increase in the number of cells in the prostate causes the prostate to enlarge. And when it enlarges, it essentially reduces the space here for urine to leave from the bladder out the urethra. So in the case of benign prostatic hyperplasia, it's not cancerous cells, but there are an increase in the number of cells. Cells are being produced in excess. And that, with aging, particularly in men, is associated with an enlarged prostate. Now, this procedure happens through the urethra, and that's why it's called transurethral resection of the prostate. So the instrument is placed through the urethra, and that essentially excess material or the excess prostate tissue is removed through the urethra to allow for the normal flow of urine. Another example here that we'll use for trans is transdermal. Now, transdermal it translates to through the skin. So transdermal means medication is delivered through the skin, and in this way it's absorbed into the bloodstream. This is often used for nicotine replacement. So nicotine patches are a common example of a medication delivered through the skin. Also, there are forms of birth control, nitroglycerin, which is used to treat angina, and also some pain medications. So analgesics are pain medications. So the trans portion of this term is highlighting that the effect passes through the skin to the blood vessels that are beneath the skin and reaches the circulatory system. Okay, so we've gone over a number of prefixes for location. Now, I have a couple of checkpoints here. The first one, and this first one we're not going to take up together, but I want you to take a moment, even on your own, or if you have peers in the course and can work together, to refer back to these prefixes for location. For each prefix, I'd like you to try to generate 2 to 3 other words that use the same prefix on your own, and then compare with those who you're working with, whether you're taking this course with a peer or if you have other individuals you might know in the class. And I want you to consider, what does the term mean and what are the component parts within the term? So I provided some different examples of the use of each prefix in different contexts. The location prefixes are used in a variety of ways to describe the location of various parts in the body, depending on what root is being used. And so to practice our combining forms, but also recognizing the use of similar prefixes in different contexts and with different combining forms attached, this kind of activity can really help with practicing that and exposure to that. But these next questions, the true or false, I'd like you to take a moment and pause the video and review or go through these true and false questions, and then we will take them up in a moment. Okay, so hopefully you paused the video there and worked through these particular examples. So let's take these up together. True or false? The supraspinatus muscle is located below the spine of the scapula. True or false? If you said false, that is correct. Supra, as we know, refers to above. So being that supra means above, the supraspinatus muscle is actually located above the spine of the scapula. Next, the pericardium is located within the heart. If we look at this word, peri means around or surrounding, right? So the pericardium is actually located around the heart. True or false? The intercostal muscles are located between the ribs. In this case, this is true. Inter means between. So intercostal means between, pertaining to, the AL, so pertaining to, between the ribs. So these are the muscles that are between the cartilage of the rib cage. Endocardium refers to the layer inside the heart. This is true. So the endocardium is the most inner lining of the chambers of the heart. And finally, extracellular fluid is located inside the cell. This is false. We talked about how extra means outside, kind of around. So extracellular fluid is outside of the cell. If we were referring to inside of the cell, what would the correct prefix be here that we would add on to cellular if we're talking about inside the cell? If you said intracellular, that would be correct. So extracellular is outside of the cell. Intracellular would be inside. Intercellular would be between two cells. Okay, so let's move on to prefixes for quantity, degree, and size. Now, I'm going to start with hyper and hypo. These two prefixes are used in many different contexts. There are many conditions and disorders that use the very common prefixes hyper and hypo. It's important to distinguish which one we're using because they have opposite meanings. And so identifying and being able to interpret that a patient has high blood sugar versus low blood sugar is vital in providing the patient with the proper care, providing the proper medications to treat that specific condition. So hyper refers to excessive, too much, or above. Hypo refers to deficient, too little, or below. Note again that for the meanings here, we have excessive or too much, so quantity, right? But we also have above or below. Now, the above and below could be related to quantity or degree, like the extent of how much it is above or below. So in the case of hyperglycemia, how high the blood sugar is versus how low it is. But there are some situations where hyper, specifically hypo, is relating to a location or a position, as we said before, with hypochondriac region of the abdomen. But in a more general sense, we see hyper and hypo when we are discussing quantities. Hypertension versus hypotension. Tension is referring to pressure. So hypertension refers to high blood pressure. So high pressure within the vessels of the cardiovascular system. Hypotension refers to low blood pressure. For the thyroid, hyperthyroidism is a condition of high thyroid activity. And on the opposite end of the spectrum, hypothyroidism would be a condition of low thyroid activity. And finally, hyperkalemia and hypokalemia. These are blood conditions. Now we know the suffix emia refers to blood condition. We have our prefix hyper, and then the cal is referring to potassium. A way that I like to remember that is potassium as an element is K+. So hyper, like on the periodic table, so hyperkalemia is referring to a blood condition with high potassium. If there's high potassium in the blood, this would be a medical emergency and needs to be treated. And hypokalemia, on the opposite end, blood condition with low potassium. Now, in your bio courses, probably in your cell bio course and even in your anatomy course, you will likely discuss hypertonic, isotonic, and hypotonic. Tonicity refers to the solute concentration in a given solution. So a hypertonic solution is a solution that has a high concentration of solutes. If a cell, such as a red blood cell, for example, is placed in a hypertonic solution, according to the laws of osmosis, water will follow solute, or water will follow wherever there is more solute or higher solute concentration. So if the concentration of solute, such as salt, is higher in the solution outside of the cell, or you could say in the extracellular fluid, so the fluid surrounding the cell, if the concentration of solute is higher in the extracellular fluid than it is within our cells in the intracellular fluid, then water is going to leave our cell and the cell will shrivel. And we can see here that these red blood cells are shriveled up. Now, if a substance is in an isotonic solution, iso refers to the same. So isotonic is where the solution has the same solute concentration as inside of the cells. And in this case, the cells maintain an appropriate shape. There is no net flow of water. So essentially these cells are in equilibrium. There's no net movement of water out or into the cell, so the cell maintains its shape. Finally, in a hypotonic solution, where there is a lower concentration of solute in the extracellular solution as compared to the intracellular solution, now there will be a net movement of water into our cell, and our cell will actually expand, and at times we can see here the cell can burst and undergo lysis. Okay, let's proceed with our prefixes for quantity, degree, or size. We have quite a few here, and the reason for that is these particular prefixes are referring to quantities and specific numbers. So, nully meaning none, uni meaning one, bi referring to two or both. In the case of both limbs, for example, like both legs, both arms. Bin is also referring to two, think like binary. The example here, binocular, pertaining to both eyes or two eyes. Tri means three and quadri means four. So some examples here. The triceps muscle is located on the dorsal side of the upper arm, so on the back of the upper arm. It has 3 attachment points. There's a lateral attachment point, so to the side, a medial attachment point more to the middle, and there's also a long attachment point that joins the humerus, which is the upper arm bone, and the scapula, which is the shoulder bone, the back of the shoulder blade, to the ulna. The ulna is one of the bones in the forearm. So triceps muscle is named accordingly because it has these 3 attachment points. Now, I'm going to come back up to here and work through these meanings here. So nulli meaning none. Nulliparous is referring to no birth. So it's specifically referring to an individual that has had no births. So nulliparous. Uni meaning one. Unilateral refers to pertaining to one side, for example. So just specifically one side of the body, say. Bilateral would be pertaining to two or both sides of the body. So you may have unilateral pain if you have pain on one side of the body. Bilateral pain would be pain on both sides. Bin referring to two, again, binocular, 2 eyes, think binoculars. Tri, 3, we use the example of triceps. And finally, quadri for 4, think quadricep muscle. So the quadricep muscle is named accordingly because there are 4 muscle groups that make up the quadriceps in the thigh. And we also have quadriplegia here. Quadriplegia refers to paralysis of all 4 extremities. Now, in the case of spinal cord injury, and this is quite interesting, so I'm going to highlight how this works anatomically and physiologically, but basically, when a spinal cord injury occurs, depending on the location of the injury, that will determine what structures in the body are paralyzed. Excuse me. So, if an individual has an injury at the cervical region, so in the cervical spine of the neck, and say there is a complete severing of the spinal cord at the cervical region or near severing, that individual would be paralyzed from the neck down. If the particular injury is just at the base of the cervical spine, now it would be the case where paralysis would be viewed from the base of the spine down and so forth. So if the injury was at the thoracic region, below the thoracic spine is where paralysis would be. And finally, a person with paraplegia, so relating to both legs in this case. Paraplegic refers to the case where there is a spinal injury kind of here in the lumbar spine, and this individual would be paralyzed from the waist down. Okay, now hemiplegia, plegia again meaning paralysis, plegia specifically, and hemi means half. So hemiplegia refers to paralysis of the right or left side of the body, and this is commonly seen in an individual who has experienced a stroke or a cerebrovascular accident. This is different, again, than paraplegia because paraplegia is paralysis in the lower half of the body. Quadriplegia, as we saw, affects all 4 extremities. Hemiplegia is half of the body. So in this image here, kind of this diagram, what it's showing is depending on the location of the stroke, so of the blood clot that is occluding blood flow to the brain, once a blood clot is preventing blood from flowing to a particular region of the brain, that region of the brain and those cells become damaged and die off. And as a result, that portion of the brain is no longer functioning, and it's no longer sending the signals that it needs to those particular structures. And depending on which side of the brain this is occurring on, it could affect just one side of the body. Other medical terms with hemi include hemigastrectomy, so gastra, stomach, ectomy is removal, so hemigastrectomy is removal of half the stomach. If we add in instead the root col, referring to the colon, so it'd be removal of half the colon. And then hemiarthroplasty is the surgical repair of half of a joint. Now, this is rare, but at times an individual might require a partial hip replacement if they were to fracture the neck of the femur. So the femur has a particular structure. This is the bone that is within the thigh. So the femur comes upward towards the hip, and there is a kind of narrowing here and we call this the neck of the femur. And then the head here positions into the pelvic bone, and this is where the pelvis and the leg articulate with one another. Now, if there is a fracture to the neck of the femur, then an individual might need to surgically repair just half the joint that is, or the part of the joint that's relating to the femur specifically, because a joint is made up of 2 bones that articulate with one another. Okay, now let's look at quantities, not specific to a certain number, but more about half, many, few, or all. So hemi, again, we saw half. Multi means many. Multipara means many births. So again, we talked about nulliparous, meaning no births. Multipara would be many. So para, again, meaning births brought forth. So multipara would be many births. Oligo means few or very little. And the term here is oliguria, which is below normal or very little output of urine. So if an individual is perhaps experiencing kidney failure, they may produce a lower urine output. Pan means all. We've seen this term before, pancytopenia, meaning deficiency in all blood cells. So white blood cells, red blood cells. And poly means many or much. Polydactyly, specifically, means many digits. So poly, many, and the dactyly refers to digits. So this condition can refer to either the fingers or toes. It's often an inherited condition through previous generations, so inherited from, say, the grandparents. It can be associated with certain genetic mutations where an individual will have more than 5 fingers or toes. Poly can be used in many contexts. So polydipsia means pertaining to much thirst. Polydactyly, as we've seen. Polycystic would be many, pertaining to many cysts. Polymyositis, this is an interesting one. So poly, many. Myo, we know, means muscle. Itis means inflammation. So inflammation of many muscles. Note that when we are discussing the meanings of the terms, again, we start with the suffix and then we read from left to right, from prefix to combining form. Polyuria, as we said before, oliguria, meaning below normal or very little output of urine. Polyuria would be too much or producing much urine. And finally, polyposis means a state of many polyps. So polyps are growths. So excess cell growth that is not yet cancerous. So polyps can occur in the colon, for example, and they could be precancerous, in which case they would have to be removed if they're investigated further to see if the cells have the potential of becoming abnormal. So polyps are essentially just growths. Okay, now size. Macro versus micro. Macro meaning large, micro meaning small. Think microscopic, right? A microscope is used to view very small things that are microscopic. A macrophage, as I mentioned previously, is a type of very large white blood cell. So our white blood cells are part of our immune system. And macrophages are a particular immune cell that will actually engulf foreign pathogens, harmful microorganisms that are in our body. They will engulf them, and within the macrophage, there are enzymes that will break down whatever was just engulfed. In this example here, we see our macrophage, and it has lysosomes within. Lysosomes contain enzymes that are going to break down harmful substances. And here we see some virus particles. So pretend this macrophage is present in our upper respiratory tract, for example, and our upper respiratory tract may be presented with a virus. The macrophage will actually change its shape to engulf or surround those viral particles. As it does that, it brings them inside of the macrophage. Almost, and this process is actually referred to as cellular eating. So once the macrophage brings that virus in, it will release these enzymes, the digestive enzymes that are within the lysosomes, and those digestive enzymes actually digest and break down the virus into particulate matter that can no longer confer negative effects on our body and on our immune system. Once it breaks down the virus, it then releases the viral particles, if you will, as waste material, and that the body will just rid these particular particles. So macrophages, even though they are the largest type of white blood cell, they are still very small in the sense that you require a microscope to view them. They cannot be viewed with the naked eye. Now, the prefixes tachy and Brady refer to speed. So tachy refers to fast and Brady refers to slow. Now, common contexts for these prefixes are when we are referring to heart rate. So tachycardia refers to a rapid heart rate. Here we can see a recording from an electrocardiogram, and we can see an individual's heart rate here. We can see the contraction of the ventricles, which produces a stronger signal than of the smaller atria, the chambers of the heart. And we can see an individual's heart rate, so we can see the frequency of each of these contractions. Now, an individual with tachycardia will have a rapid heart rate, so faster than normal. So tachycardia directly translates to, so IA is a condition of a fast heart, so a fast heart rate. Now, normal heart rate is around 60 to 100 beats per minute. If heart rate is well over 100 beats per minute, particularly if someone is not exercising. So this is specifically referring to more so resting heart rate or prolonged high heart rate that does not come back down to normal after resting. So we can see that the number of beats here is much more frequent than the normal heart rate. On the other side, bradycardia refers to a slow heart rate. Now here we can see normal sinus rhythm, 60 to 100 beats per minute. And with bradycardia, we see that there is a much slower heart rate, less than 60 beats per minute. Now, there can be various reasons why an individual would have a slower than normal heart rate. This can be due to issues with the heart's normal pacemaker, which is the sinoatrial node. So the SA node or the sinoatrial node is a region of cells within the heart that are responsible for controlling the electrical activity of the heart. So this SA node is present right here within the right atrium, and it is going to act as the natural pacemaker of the heart, sending electrical signals throughout the heart muscle, causing it to rhythmically contract at a specific frequency. Now, if there is damage to these cells within the heart, this can result in a slower heart rate. So bradycardia, condition of slow heart. D refers to from, down, or away from. And I'll use the example dehydration. So dehydration means a condition of down water. So essentially away from hydration, if you will. Hydro is that combining form for water. Now, symptoms of dehydration, we could talk about dry mouth, dry lips, dry skin. Severe dehydration can influence heart rate, can cause headache. Now, there's been some debate about how much water an individual should consume per day, and water intake does not just include the water that we drink in terms of a glass of water, but this also comes from our food. So our food, especially fruits and vegetables, have a very high percentage of water, and so they actually contribute to our body's water intake. Now, some think it should be around 6 cups of water per day. This can vary depending on individual needs. Particular medications that people take may require people to drink more water. Now, if I were to ask you, how does the body balance water intake? You can pause the video and maybe think about that or ponder. But essentially, our body is going to balance water intake largely due to the role of the kidneys. So the kidneys are very critical in fluid balance, regulating the amount or the concentration of the urine influences how much water is present in the body. So, checkpoint. I'll give you a moment if you want to pause the video, and then we'll take these up. Okay, so hopefully you took a moment to take a peek at these questions. So, sorry, my slide is just moving a little bit here. Okay, so let's take these up together. First, true or false? A biceps muscle has only one muscle head. If you said false, that is correct. We know that biceps bi means 2. So biceps muscle has 2 muscle heads. Hyperglycemia means high blood sugar. This is true. We know that hyper means high. Hypo would refer to low blood sugar. Now, oligodendrocytes. Some of you may know what this particular cell is, but these are cells that are part of our nervous system. Now, if we look at the prefix, though, so we see a common prefix that we've seen before, oligo, dendro, and cytes. We know cyte is the suffix for cell. So we know this is a type of cell. Dendra or O, this is particularly referring to the extensions of these type of nervous cells, and they look like branches. So the question is, oligodendrocytes have many branches, few, or one branch? If you said few or very little, you're correct. Oligo refers to few or very little. And finally, fill in the blank. Blank cystic means many cysts. Now, we know that the prefix for many is poly, right? Polycystic would be many cysts. If it was multicystic, this is also another way of indicating many. If it was nullicystic, then this would be none. Okay, so let's continue. Actually, I'm going to look at the time here. You know what I may do? I think I'm going to pause the video here and stay tuned for the final part where I will cover the rest of the slides.